Hi, Nursing 6113, Dr. Kim Paxton here. Week number 9 in Global Health. I apologize for getting this up to you late. I had it recorded and for some reason it was not giving the audio part, so I had to re-record this. First, I'd like to start off with saying that from last week, week number 8, and your discussions, they were absolutely stellar. Really great sharing of the health apps and your discussion on the pros and cons of those. Technology is really coming into play with relationship to health promotion and prevention, and being able to speak to these products and understand them. We need to be able to do that so we can translate that to our patients in our primary care settings, whether it's somebody who is pregnant and going to deliver this cute little child, or it's somebody who's 90 years of age and we need to work with them and help them with an automated scale that connects to a computer for management of CHF. So really great job, and thank you so much for putting in all the effort that you are on your discussions. This week with global health and disaster preparedness, one of the big components has to do with collaboration. There's collaboration that needs to occur for global health and disaster preparedness along multiple lines of professionals, from our active military to those in reserves, to the firefighters, to the nurses, to the care providers, both the surgeons and general practice physicians who volunteer their time to work and to improve the health internationally and to report to disasters. In your readings this week in chapter 25, there's a lot of information in here, and I'm sure some of you have already started on this, but there's a specific section that I really want you to pay a little bit of attention to and put it on your radar screen. And that section has to do with violence. As you are aware from listening to the television and reading in the newspapers and what comes across in your tweets and what comes across via CNN live feed, there is this abundance of different acts that are occurring, and it affects people both in their own communities but globally with respect to personal safety, and in also its impact on post-traumatic stress disorder, depression, and anxiety. Right now there's a hot trend occurring, and several of you have spoken about it in past posts related to suicide, and there's an increase in suicide among teens. As many of you are aware, I've come from Wisconsin, and we had a suicide pact that was occurring amongst teens in a junior high school. And it started with one teen hanging themselves, and every 30 minutes after that first teen's death, another teen of that group hung themselves. So altogether there were 8 students that committed suicide, all within a 4 to 5 hour period of each other. And each of them had left notes and spoke about why. Why am I doing this? And what prompted me? And what happened to cause me to reach this point? It was very enlightening. Several of these individuals wound up in my emergency room, and we attempted to care for them. Unfortunately, with their access and C1, C2 fractures, there wasn't anything we could do. But it was very distressing to us as care providers, and even more distressing to the parents and to the other peers of their group who were affected by this. So bringing this violent component up to the surface, that it's something that we need to be aware of as advanced practice nurses. We need to be able to speak to it, and we can't just pay lip service to this violence. We need to be able to really speak to it and listen to it and be able to understand how we can assist to intervene if it is occurring with our care provider. We have 2 other articles that we're reading this week, the Spain one and the one on disaster preparedness, the public health nurse perspective. Both of them provide you with some really interesting perspectives on how we as advanced providers integrate in to this. So read one of those, see what you take away from it. We do have a discussion that'll kind of relate back to that. For your discussions this week, some of you last week, you gave some interesting points of view. Others were a little bit on the brief side. even if you haven't been exposed to this, that you can remember there may be an element that's an outside the box element that you have been exposed to. And every one of us has been exposed to violence on the television, in the newspaper, bullying that may have occurred at work. Everybody has been exposed to some level of this. So you can speak to that, and that is a global health need. The third question, have you been involved in a disaster preparedness planning at your agency? This could be from your unit level to actually being a participant in a disaster preparedness scenario that took place. Maybe you were a victim, maybe you were a coordinator. If you work in the emergency room or if you worked in critical care, they have disaster drills that occur and you go on alert. Speak to it from that perspective. And then the last thing for your discussion is we actually want you to go to your website for your county or your city and look at what their disaster preparedness plan is saying, and look at it. What are they offering? And is there a place where you as an advanced practice nurse could potentially fit in? So take a look at these. If you want, you could even potentially compare yourself to another city of similar size or a county of similar size outside of Colorado to see how well does Colorado measure up to what's occurring in other communities. Your poster this week is your big project, and several of you are already working on it. As I have gotten feedback from some of you and asked for coaching from others, I want to make sure that you are understanding that there needs to be on this poster really clear understanding of the concepts that you are asked to bring forward, and that aesthetically to the eye, it gives the appearance that you put effort into your poster. Make sure that on your poster you do give that overview, that you talk about the background, that you really identify the characteristics of the population, and you identify that level of prevention. For the use of social media and websites, you're looking at what that health promotion program that you're assessing for your poster. What do they use? How do they use it? Are they easy to use? Is it geared just for one specific population and not another? Make sure you bring that forward. In looking at this rubric, I want to make sure that you have all these elements present. So make sure you use the rubric to help guide you in making sure, okay, I've got my heading and I've got everybody who worked on this poster's name there with their credentials. That you've identified the community health promotion program and the focus. The next part, the poster layout, there are 10 points associated with this. And I just talked about them, but there are 2 other elements that are present on this that you need to make sure that you incorporate. One of them is that you have a table or a graph, and that you also have pictures of interest. In working with some students to give them feedback on what they've already produced, one of the elements that I'm seeing come forward is that pictures are overlying words, or that graphs are overlying words, and that content seems to be jumbled and not clearly identified, almost like you were using a heading, but you can use a text box instead, and which is causing confusion when you look at the slide. Make sure that any pictures or graphs that you're using do not overlie any type of information that you have in print, and make sure that your information is organized into its appropriate category and you're not running one into another. When it comes to identifying that level of prevention, state what it is, but then give your rationale for why it is that. The evaluation of the website or social media, and if you wanted to, you could even do a screenshot of that, save that screenshot as a picture, and then upload that onto your actual poster to actually give us what it looked like that they're offering for you to be able to use. With respect to APA format, I know that Scott has provided you with a lot of feedback and a lot of information about how to do this. And we are sticklers on APA. For the poster, it's a little bit different though, because it's not a paper, it's not an 8 by 11 inch document. It's a poster, and so the formatting isn't going to be able to fit appropriately on this. You do not have to double space, you can single space this. The indenting that comes really doesn't come over very well on the poster, so you can just do it all left flush. We're not going to take points off for that. We need to make sure that you are properly citing any pictures, or that you cite direct quotes that you're taking off of your program, and that you actually give that citation with those areas. When you're doing your reference point, however you choose to do that, please make sure that you have the actual formatting of it correct, except for the indentation, and that we will be looking for. As you're working on this, please make sure you're having fun. It is supposed to be a fun project, a different way of doing something versus doing a paper. For those students that may have already submitted a poster, the due date is not until Sunday. So you're able to go in and redo things if you want to, and then repost it, because we would take the last thing that you submitted as the element that we would grade. If you have any questions, please make sure that you're contacting either myself or Scott. Have a great week.